Have you heard the buzz about Ozempic and Mounjaro? These medications are making headlines, not just for managing type 2 diabetes, but also for their significant impact on weight loss. But what's the real story behind them? Are they miracle drugs? What are the benefits? And more importantly, what are the risks? Today, we're diving deep into the world of these new generation diabetes medicines to give you the clear, straightforward information you need. Let's start with the basics. What are these drugs? Ozempic, with its active ingredient semaglutide, and Mounjaro, with tirzepatide, belong to a class of medicines that mimic natural hormones in our body. Specifically, they act like GLP-1 or glucagon-like peptide-1. Mounjaro goes a step further and also mimics another hormone called KIPE. These hormones are released by our gut after we eat, and they play a crucial role in managing our blood sugar levels. So, how do they actually work? It's pretty clever. First, they tell your pancreas to release more insulin when your blood sugar is high. Insulin is the key that unlocks your cells, allowing sugar to enter and be used for energy. This helps lower your blood sugar after a meal. Second, they slow down how quickly your stomach empties. This means you feel full for a longer period of time, which naturally leads to eating less. Third, they signal to your brain that you're full, reducing your appetite and cravings. This combination of effects is what makes them so powerful for both blood sugar control and weight management. For people with type 2 diabetes, the benefits can be like these medicines have been shown to significantly lower A1C levels, which is a key measure of long-term blood sugar control. Better blood sugar management means a lower risk of serious diabetes complications, like heart disease, kidney problems, and nerve damage. In fact, some studies have shown that drugs like Ozempic can directly reduce the risk of major cardiovascular events like heart attacks and strokes in people with type 2 diabetes and existing heart disease. This is a huge step forward in treatment. And then there's the weight loss. This is the side effect that has everyone talking. For many people with type 2 diabetes, losing weight is a critical part of managing their condition. These medications can lead to substantial and sustained weight loss, often far more than what can be achieved with diet and exercise alone. We're talking about an average of 15% of body weight with Ozempic, and even more with Mounjaro, sometimes over 20%. This isn't just about fitting into smaller clothes. It's about reducing the strain on your joints, improving mobility, and lowering blood pressure and cholesterol levels. The weight loss itself contributes to better blood sugar control, creating a positive feedback loop. But it's crucial to understand that these are not just weight loss drugs for anyone who wants to shed a few pounds. They are powerful prescription medications designed to treat a medical condition. In the US, Ozempic is approved for type 2 diabetes, while a higher dose version of the same active ingredient is approved for weight management under the brand name Wegovy. Similarly, Mounjaro is for type 2 diabetes, but its counterpart for weight management, Zepbound, is also available. They should always be used under the guidance of a healthcare professional. Now, let's talk about the part that often gets overlooked in the hype. The side effects. Like any medication, these drugs are not without their downsides. The most common side effects are think nausea, vomiting, diarrhea, constipation, and stomach pain. For many people, these side effects are mild and tend to decrease over time as their body adjusts to the medication. Doctors usually start patients on a low dose and gradually increase it to help manage these issues. It's also why staying hydrated and eating smaller, blander meals can be helpful, especially in the beginning. However, there are more serious, though much rarer, potential side effects that you need to be aware of. These can include pancreatitis, which is an inflammation of the pancreas that can be very painful and serious. Other risks might include gallbladder problems, such as gallstones. There have also been reports of gastric or stomach paralysis, a severe slowing of the stomach that can lead to persistent vomiting and malnutrition. And there's a boxed warning, the most serious type of warning from the FDA on these drugs, about a risk of thyroid C-cell tumors. This was observed in animal studies, specifically in rodents, while the risk in humans is considered low and hasn't been definitively established. People with a personal or family history of medullary thyroid carcinoma or a rare condition called multiple endocrine neoplasia syndrome type 2 are advised not to use these medications. It's a reminder that we're still learning about the long-term effects of these powerful drugs. Another thing to consider is what happens when you stop taking the medication. Studies and anecdotal reports show that when people stop using these drugs, the appetite suppression goes away, and the weight often comes back. This suggests that for many, these might be long-term, or even lifelong, treatments for the chronic diseases of obesity and diabetes, not a short-term fix. This raises important questions about costs, access, and the long-term commitment required. Speaking of costs, these medications are expensive, often costing over $1,000 a month without insurance. While many insurance plans covered them for type 2 diabetes, getting coverage for weight loss can be more challenging. The high cost and supply shortages, driven by the massive demand, are significant barriers for many people who could benefit from them. So, what's the bottom line? These new medications represent a major breakthrough in the treatment of type 2 diabetes and obesity. They offer powerful benefits for blood sugar control, cardiovascular health, and significant weight loss that can dramatically improve quality of life. They are transforming how we approach these chronic conditions. However, they are not a magic bullet. They are serious medications with a real risk of side effects, from common digestive issues to rare but severe complications. They require careful medical supervision, a long-term commitment, and a conversation about what happens if you ever stop. The decision to start one of these drugs should be made in close partnership with your doctor. After a thorough discussion of your personal health history, your treatment goals, and a realistic look at both the incredible potential and the possible risks. It's about weighing the pros and cons for your specific situation. If you are struggling with type 2 diabetes or your weight, please talk to a healthcare professional. They can help you explore all your options, from lifestyle changes to medications, and find the path that is safest and most effective for you. Remember, managing your health is a journey, and having the right information is the first step. Thanks for watching today. We hope this gave you a clearer picture of these new and important medications. If you found this video helpful, please give it a thumbs up and subscribe for more balanced health information. Stay safe, stay informed, and we'll see you in the next video.